You know, it's interesting. I want to piggyback on what you said about not creating that tension, but the reality is a lot of times we get into those conversations or those situations. I have plenty of patients that I've worked with over the years where maybe an older child, an adult child, was making some of those decisions on behalf of their elderly parent who was going through memory challenges, and then gets wind of another sibling gets wind of it, and then there's conflict. And then the reality is that nobody wrote anything down and nobody had that discussion.
Right.
And that is a very tough situation to be in, because now you're fighting over different things for that elder parent that you're caring for, and now somebody gets dragged into that, and then we're talking about not preserving the dignity of that individual or their wishes.
You made a very important point,
Please.
and I think it's so helpful for families to literally sit and talk about this. And the recommendation is to build a dream team, and that dream team is going to involve a medical professional, a financial advisor, and in some cases it'll also involve a legal advisor to make sure that everything is in place the way it should be. But also just to listen, forget the dollar signs and the legalese, and say, what is your wish when you are 85 or 75 or 90? And have those conversations and make sure those plans are in place and followed up on it. It's one of the things that helps avoid that kind of conflict with families who are, in some cases, we say they're in mourning and in the dark because they've lost the parent that they once knew. And they're in the dark about what's going on, and that reaction sometimes is one of fear. This is one of the greatest fears of Americans facing Alzheimer's.
Please go ahead,
And
Jason.
when I think about that, that fear is real, not only for the
Absolutely.
individual, but for the one they're caring for. Because you'd mentioned, what happens with the person. Unfortunately, dementia oftentimes is referred to as a disease of two deaths. Because you have the individual that suffers from the dementia, and their personality changes as
Absolutely.
it progresses. And so you're taking care of the person that they used to be. You're preserving the body out of respect for that loved one that has raised you or been such an intricate part of your life.
Yeah.
And then you have to watch the body deteriorate until eventually it fails, and then you have to mourn that. It's heartbreaking, which is why it's so important that not only the individual has somebody to help them, but also the caretaker, because
that's so
caretaker
important.
burnout is so prevalent. The doubt, the despair, just not feeling that they have anyone to turn to, and it leaves you feeling very alone as a caretaker.
When I was a resident at the VA hospital, what would happen quite often when I was on call and in the ER, you would have family members drop their elder parent off. At this, I'm a gentleman at that time, but you would have the elder parent would be dropped off in the ER, and before you can get down there and get a story from the parent, from the elder child, that they were nowhere to be found. And it's like it got to a point where they had a breaking point and said, I can't do this anymore. I don't have the resources. I don't know what to do. I'm frustrated, all this kind of stuff. And then here, just take it from here. And then you're trying to play detective as a clinician on call to find out, what does this person need? The person can't say for themselves. What are their wishes? Oh, there's something documented. And so it's just a snowball effect that can have significant ramifications. And so we have to continue to have this conversation. If we don't have this conversation, which we're having this today, but if people out there aren't listening, are not having that conversation, then it's going to be hard for us to help you out.
Right. And that is why conversations like this between all of us are so important. So important.